Hi everyone, I'm Susan Birch and welcome to another Health Detective podcast. And today I have the very amazing Dr. Robert Cywes with me today. And Dr. Rob is known as the Carb Addiction Doctor. So we're going to get into talking to him about that. Just a little bit of brief background. He's a medical doctor, a bariatric surgeon who is in clinical practice, and he is also a PhD doctor. And he's the author, or one of the authors of this fabulous book called Diabetes Unpacked. So I hope everybody takes notice, and it's a well worthwhile book reading. So Dr. Rob, thanks for being here.
Oh, thanks very much, Susan. You know what's interesting? That book was written a few years ago. And if you look at the list of authors, I contributed a chapter, but so many of the big names when we were younger are in that. Jason Funn's in there, Tim Noakes is in there, Zoe Harcum's in there. It's really nice to go back and look. That book is about our roots. And it's amazing how true the information is and how consistent that information is even today. So it's very cool that you brought that up. I appreciate that.
Yeah, no, I think it's well worth, it's a great book and it's well worth everybody having a read of. So, before we start talking about diabetes and health and obesity, well done on the win on Saturday.
Well, as I said to you, it's rare that we do that. So we celebrate a little bit more than they probably do New Zealand for a win, because you'd be celebrating all the time. So it was kind of nice, but we'll see. There's one more coming up, so we'll see.
Yeah, we're looking forward to that one.
Yeah.
So you've been helping people with obesity and type 2 diabetes for more than 30 years, I think. Can you tell us a little bit about, what got you moving from the surgical management into the carb addiction process, and why that's so important?
Right. Well, first of all, it's personal. I've topped out at 300 pounds. Are you in pounds or kilos? You're in kilos.
We're in kilos, yeah.
Yeah, so you divide that by 2.2. But I mean, I was a very hefty person. My BMI was over 40. And I had to look at myself and say, okay, what's going on with me? How did I get here and what do I do about it? So it's personal. In the laboratory, I worked with sugar and in liver transplantation, and realized that pretty much all the good things that we ascribed to sugar in the early 1990s was actually completely wrong. And when we thought sugar was so important, sugar was so beneficial, I realized with the work that I was doing, the more sugar you added to the liver, the less well it performed. That you could create diabetes in the liver, you could create a fatty liver very readily in the laboratory, and it was inconsistent, in fact, polar opposite to what the current belief was. And or the currently held science at that time. In fact, the guy was on my PhD committee, David Jenkins, is the father of the glycemic index, which is what other doctors use to treat diabetics ineffectively. So we butted heads a lot about that. Then the final piece is in surgery. I'm a pediatric surgeon by training, a general surgeon, pediatric surgeon, and I was operating on kids who had a variety of issues like gallstones, cholesterol gallstones, polycystic ovarian syndrome, obesity, that had surgical issues that I was correcting, all as a consequence of their obesity and what they were eating and drinking. And yet I had no framework for addressing that with them. And when I looked at, there was one particular kid, a 14-year-old kid that weighed well over 200 kilos. And I'd taken his gallbladder out, and I went into his room afterwards and I looked at what he was eating. And, the popular belief is the guy's eating a ton of fat. Well, he was eating bread and fries and ice cream and chocolates and drinking a large Coke. So about 80%, 90% of the calories he was consuming was sugar. And yet we were still blaming fat for his obesity. Well, how can something that you're not eating make you enormous? And how can we be oblivious to something that is a mountain of things that this guy's eating? How can we not blame that for their obesity? It's a little bit like in the 1950s and 60s, you smoking 20 cigarettes a day and you got lung cancer. How can it not be the cigarette?
Mm. And we've got the same issue, haven't we? Back in the day with cigarettes, they weren't considered a problem. I think, women were encouraged to smoke cigarettes to help reduce their stress and their menstrual issues. And, it's pretty much the same today with sugar and carbohydrates. And I think, everyone's talking about sugar, but there's still a lot of misunderstanding about carbohydrates as a whole, and that they all end up being sugar.
And I think that's so true, because one of the key things I tell my patients is that it doesn't matter what form that carbohydrate or that sugar takes going into your mouth. Remember that your intestine is outside of your body. So when you swallow an apple or whether you swallow a donut, it's still outside your body. Then the walls of your intestine, the enzymes interact with that and they break them down to sugar. So whether you eat an apple or whether you eat a donut, ultimately what enters your bloodstream is glucose and fructose. It's not an apple, it's not a donut. And the apple actually has more on average sugar in it than the donut. Now, the other critical thing, and I think this is so important in our space, is that sugar causes no harm. Throughout our existence as a species, carbohydrates have added survival advantage to who we are as a species. So one of the critical things is not to demonize sugar. I drink red wine. I love my South African red wine. And I know in New Zealand, the folks there imbibe a little bit of alcohol. Alcohol is never a problem. A glass of red wine is very healthy. But if I was an alcoholic, my relationship is the problem. Mm-hmm. If I'm 300 pounds or I have diabetes, it's not the carbohydrates, it's my relationship with them that is the problem. So if you're a regular, healthy, skinny person, glass of wine or an apple is fine. If you're an alcoholic or an obese or a diabetic person, not so much. And the challenge there is to look at yourself and your relationship with that substance and what that relationship has done for you, rather than to demonize the drug itself. There are millions of people, if not billions of people all over the world that are alive because of carbohydrates. Your peasants in China and India who are eating rice, your Somalians, the people on my continent who are subsisting on some grains but they eat very little and it's for survival. The problem in the modern era is this massive abundance in the modern world of an excess of food, or in the broadest category. So no longer are we facing food scarcity and food deprivation in most places. Even in New Zealand, in America, and large parts of South Africa, we are now for the first time ever dealing with abundance, and we don't have coping strategies. Most of us live within 50 yards or 50 meters of an abundance of food. So it's not like it's scarce, we have to eat what we can get. We now select food, not necessarily based on its nutritional value, but on how it makes us feel, because we have choices. And if you choose food that gets you high, that's problematic.
So can we talk a little bit about that? How does carbohydrate addiction relate to, the similarities to alcohol addiction?
Yeah, there's a woman by the name of Nicola Vino who works in New York. She's a psychobiologist, a neurobiologist, and she has done some incredible work with animals and humans, looking at the way our brain responds to various food categories. And fat and protein has no major response in the brain. But sugar and cocaine light up the brain like it's fireworks. And so the endorphin, the stress relieving effect of cocaine, of alcohol, of nicotine, and of carbohydrates is very equivalent. And what we do is we latch onto that very powerful instant gratification effect. Steak and broccoli doesn't do it. Water doesn't get the alcoholic drunk, but alcohol does. And it's the same principle. So I will make a statement to you that I will support through thick and thin. It is impossible to get fat from eating food. It is impossible to get drunk from drinking water. It's alcohol that makes us drunk, and it's sugar and starch that makes us fat, because the human body has very powerful checks and balances, hormonal checks and balances, when it comes to drinking water and when it comes to eating protein and fat. But it has no checks and balances. In fact, quite the opposite. It has a proactive, positive cycle when it comes to drinking alcohol. The more you drink, the more buzzed you get, the more you want to drink. And when it comes to carbohydrates, the more you eat, the more relaxed you are, the more you want. The end of a bag of chips is the end of the bag of chips. It isn't when you feel full. You could have just eaten some wonderful South African lamb, which I know most New Zealanders don't ever. No, you can eat some great New Zealand lamb, and oh my God, I'm full. And you're not eating more lamb, but you are sitting in front of the TV 5 minutes later with a bag of chips or some pretzels or some ice cream. Because you're not eating, you're getting high.
Yeah.
Same principle. So that's kind of, you want to really correlate that and look at your own behavior, look at your relationship with those things. And then you'll come to understand what the problem is.
So we all have to eat. And so if these carbohydrates are doing this to us each time we eat, what's the solution? What can we do about it? How do we reverse this? And what about our kids? Our obesity epidemic and type 2 diabetes amongst the kids in this country is, absolutely so sad. And
right. You're exactly right. And that's world over. That's world over. I mean, if you just look at one statistic that is directly related to what I call substrate provision, and the substrate are the building blocks that your body needs to grow as a child. Well, in 1970, the autism incidence in the US was 1 in 15,000 kids. In 2020, the CDC in the US reported a rate of 1 in 44 kids.
Wow.
Which is astronomical. It's well beyond any genetic changes. And the answer is so obvious. Since 1970 to now, what we've done is we've removed fat from our diet. Well, 65% of the brain is made of fat. And if you don't have fat in your diet, how do you develop the substrate to grow a healthy child's brain? And we've massively increased the amount of sugar. And sugar is not a very good substrate for brain growth. And that is part of the autism spectrum disorder. So, it's so obvious when you see it, but most of the time, as you said, with cigarettes, we've given it a free pass. Sugar can't be to blame, so we have to look for something else. And then we go look at vaccines and we go look at genetic changes and all that kind of thing, which is just not true. So sugar has become pervasive in our society. And we're talking about different countries, a Tasmanian by the name of Gary Fetke says, okay, now we can't trust anything from that side of the pond.
Those down Aussies, I support.
But Gary has a wonderful talk that he gives that says carbohydrates, the dose matters. And it's absolutely true. And if you're overdosing on carbohydrates every day, don't expect to be healthy. If you're overdosing on alcohol, if you're overdosing on heroin, you can't expect to be healthy. So the dose matters. And some people reach a critical threshold, like myself, where I no longer have the capacity to control that relationship. So I can't just eat a little bit. There's no way on God's earth I can eat 3 chips from a bag. There's a bag of chips in front of me, it's gone. If there's a tub of ice cream in front of me, it's gone. So therefore, what I've chosen to do, and it's my choice, I don't have to do this, but I've chosen to do this. I've distanced myself from carbohydrates because I love this more than that. And that is a choice that each person makes. Because the interesting that I tell my patients, Susan, is this: you and I are both going to die. That's the one absolute. How we get there is our choice. If you choose to text while you're driving, you could shorten that life very quickly, but that's a choice. If you choose to smoke or drink alcohol, that's a choice that may shorten your life. If you choose to eat sugar and starch, that's a choice you make. It probably is going to shorten your life with that heart attack, the stroke, the cancer, whatever it may be. But those are choices we make. And I can't tell somebody to make the same choices I do. I've just got to provide them the information so they can make informed choices.
So I think you raised some really interesting points there. So what's the difference between being addicted and having harmful use? We know people who have harmful use of drug and alcohols, but they're not actually addicts and they can stop. Whereas an addict has a whole different set of problems in front of them.
Yeah, very good question. So there's use, abuse, and addiction. And my definition of addiction, you won't read this in a book anywhere until I publish mine, but addiction is the chronic excessive use of a drug to the point of harm, and then distorting the reality of that harm to continue the relationship.
Right.
That relationship is now out of control. So, if I've had 5 DUIs and I've got liver disease, my relationship with alcohol is gone.
Yeah.
But if I get hammered one night and maybe get 1 DUI, if I just get trashed one night on alcohol and I wake up the next morning and say, whoa, I feel terrible, I'm not going to drink for 3 months. I've abused alcohol, but my relationship is still intact. I can cut back. If I go out and I pig out on a supersized pizza, but then for the next 3 weeks, I'm eating steak and broccoli, I'm okay. I've abused that pizza, but I'm okay. But if I'm doing that all the time, and if 75, 80% of my diet is sugar and starch, that then becomes problematic. So it really is defined by the level of harm. If you've got 10 pounds extra or 3 kilos or 5 kilos extra, that's an abusive relationship. You've just been a little bit sloppy and complacent. You can cut that back very easily. If you've got 30, 40 kilos to lose and you've got diabetes and you've got perhaps a couple of other health issues, that is entering addiction territory. Because to get to be 30 kilos overweight is not just one extra Twinkie. That has become a way of life. And addiction is defined by a dominant way of life, that you're always looking for opportunities to have that cigarette, to have that shot of whiskey, to have that sugar or starch. And if your environment, fat people have carbohydrates readily available. I used to have a big bag of M&Ms and a case of Coke here in my office. Now I've got water, my coffee's already finished for the day, but I've surrounded myself with things that do not control carbohydrates. The smoker always has a pack of cigarettes here. They crumple them up, they throw them away, they put gum in their pocket. That represents change.
I really like that description, and it's very helpful to me because I've set up a keto club here in the small community that I live in. And, we spoke earlier a little bit that, it's a fairly poor community and we have a lot of, probably overrepresented in obesity and in type 2 diabetes. And what you say is really true because, we actually have our meetings around a meal, and there is a lot of making sure that there are plenty of carbs available, the people who come along. But one of the problems that they face, and one of the questions I really want to ask you, and I'll kind of get round to this, is I've heard you talk about toxicity occurs at ingestion. Okay, and so I'll get you to explain what you mean by that. But with the people who belong to the keto club and, for all the other type 2 diabetics out there, they get told to really focus on keeping their blood sugar level by managing it with their drugs. And I'm having a very difficult time explaining to them that if they lowered their intake, they could reduce their drugs because their GPs don't want them to reduce their drugs, and the GPs then get concerned about them going into hypoglycemia. So there's kind of a whole lot of things rolled into that question, but yeah, I'd love to know.
Well, the first fundamental change in thinking is this. Do you guys have an opioid crisis or an opioid problem in New Zealand?
We have a drug, yeah, we do have some drug problems. Yeah.
So here in the US, opioids have gone through the roof. Yeah. Right. So if I said to you, you know what, you have to use 3 grams of heroin every day, but I'm going to give you some Narcan that you carry in your pocket, and as soon as you stop breathing, use the Narcan. That is a ludicrous statement. And yet that's exactly what most doctors treating diabetics do. You've got to eat this amount of sugar, and then here's a medication that's going to lower your blood sugar. Well, if I didn't take the heroin, I wouldn't need the Narcan. If I didn't take the sugar, I wouldn't be diabetic. I wouldn't need the medication. And that is 100% fundamentally true. But just to step back from that for a second, the common belief by most people, by most healthcare workers, is that the consumption of sugar is necessary for human survival. And that is an absolute false statement. The human liver is extremely adept at manufacturing sugar. So if you never, ever ate a carbohydrate, a sugar or a starch ever again in your life, your blood sugar would be absolutely normal because your liver produces it. So now, when you can't handle the amount of sugar in your bloodstream and your doctor's telling you have to eat this amount of sugar, you can't clear it because you're insulin resistant or you're not producing insulin, whether you're type 1 or type 2. So now you have to use medications to treat what you put in your mouth. Well, if you don't put it in your mouth, your body does absolutely fine. And that's, so the starting point is this misbelief that sugar is necessary for function. Then what we do is you don't suddenly become diabetic. Type 2 diabetes is related to chronic excessive carbohydrate consumption. So the way this works, and this is a little bit more complicated to understand, but when we eat sugar, the sugar goes into our gut. It may irritate the gut. So we can get irritable bowel, acid reflux, Crohn's disease, ulcerative colitis. Those are all diseases of sugar and sugar-based products irritating the intestine and creating an inflammatory response. So if you've got those diseases, get rid of the carbohydrates and they get better. But then the sugar enters the bloodstream, and when it enters the bloodstream, it triggers the release of insulin. And insulin's job is to take the rise in sugar out of the bloodstream, shove it into the cells, where in the liver it gets turned to fat or glycogen, and in the muscles it gets stored as glycogen. But if you are continuously flooding your cells with too much sugar, there's this excessive amount coming in. You need more and more insulin to shove that into the cells, but the cells fill up with sugar and they say, hey, bloodstream, we can't handle the sugar. There's too much. It's toxic to our cells. So the only defense that the cells have is to shut the front door. They close the receptor to insulin. They block that receptor. So now insulin is saying, hey, sugar, it's not working. The wall is up. Okay. So your blood sugar starts to go up. And the way the pancreas, now this is what's important, is because genetically we now have a branching of the system. So some people genetically can produce a huge amount of insulin. So their pancreas says, okay, the roadblock is up. Here's more insulin, and they can shove the sugar over the wall into the cell. Those people become enormous because the liver and other tissues are rapidly converting that excess sugar into fat because it's getting into the cells, but their blood sugar is relatively normal. They're not diabetic. So they are hyperinsulinemic. They've got very high production of insulin, and they're enormous. They're very fat, but they're not very sick. Now, their risk is Alzheimer's, autoimmune disease, and cancer. That's what high levels of insulin do. But they become very, very, so you'll see your 300-kilo person who's not very sick. The reason is because insulin has protected them from the damage of sugar. Now, on the other hand, you've got somebody who genetically can't produce a lot of sugar, a lot of insulin. So they eat the same amount of sugar. Their cells build up that wall, they become resistant, and I can't get the sugar in. So now my blood sugar goes up. The blood sugar damages the cells in the blood vessel wall and the cells floating in the bloodstream, particularly the red blood cells. Now your A1C is going up, which is damage to the red blood cells caused by sugar, and they're hyperglycemic. They have high blood sugar. They now have diabetes, and the effects of high sugar in the bloodstream, heart attacks, strokes, nerve damage, eye damage, heart damage, arrhythmias, gastroparesis, peripheral neuropathy, kidney damage, erectile dysfunction. So sugar, one drug based on your genetics, can cause two separate diseases. I'll give you a perfectly good example. If you look at the South Sea Islanders, genetically, the native Indians from India have a typically, not ubiquitous, but as a population, they have a very low production of insulin. They may be overweight, but there's a huge number of diabetics in that population. You look at some of the South Sea Islanders, they are some of the fattest people on the planet, but very little diabetes. And it's because of that different genes. Now, obviously, gene pools mix, but that is a very, very interesting epidemiologic study that the same amount of sugar has completely opposite effects. So, all because somebody's skinny, it doesn't necessarily mean they're healthier than the fattest person. The fattest person may actually be healthier than the skinny diabetic.
Mm-hmm. And so what you're describing there so beautifully is our individual carbohydrate tolerance. You know, it's like we all have our own fingerprints, and we all have our own tolerance and responses to these kinds of things.
But Susan, that's why it's so important that GPs do blood work to assess where you are. They may look at that healthy, fit, young, 20-year-old rugby playing muscular guy and say, oh, how can he have but he may be diabetic because he's carb loading, because that's what the exercise people do. And he's eating a ton of carbohydrates. So the equivalent of that, what they'll tell you, oh, because he's exercising, he's healthy. Well, nobody smokes 3 cigarettes and goes for a run to breathe out the nicotine. Nobody drinks a bottle of whiskey and goes for a run to sober. Well, you might try to do that for sober up. It doesn't work that way. But they tell fat people and people eating a lot of sugar, oh, you can run it off, you can burn it off. The damage gets done at ingestion. As soon as it goes in your mouth, it causes damage. You cannot outrun a bad diet. So they'll look at that really fit rugby player and say, oh, you must be healthy. I don't need to test your diabetes numbers. And then the guy comes in, waking up at night 5 times at night, peeing, he's feeling miserable. And they test him in the emergency room, he's peeing sugar, he's got diabetes.
And what do you like to use as testing for diabetes? Over here, it's pretty much HbA1c. Do you like to do insulin and fasting?
Yeah, absolutely, because that very large person, that 400 kilo person can have the very last patient I just spoke to before I came online, weighed 380 pounds, big boy. That's divided by 2.2. It's a huge, but his A1C was 5.0, which is beautiful. But that's because he's so good at turning sugar into fat and he's still fairly young. So the numbers, I look at A1C, I look at fasting blood sugar, but I also look at fasting insulin and C-peptide, because I hate the word type 2 diabetes. Type 2 diabetes is a threshold diagnosis. So when your A1C is above 6.5, you're type 2 diabetic. But if it's 6.4, oh no, you're fine, you're just pre-diabetic. No, your body doesn't care what the number is. The damage is happening all the time. You know, here in America, our blood alcohol limit is 0.08 when you're driving. So if you blow 0.08 at a roadblock, you go to jail. If you blow 0.07, you don't go to jail, but you're not sober to drink. And most doctors are lulled into complacency if your A1C is below 6.5. But a normal A1C is 5.2, at which level your extra blood sugar is not doing damage to your bloodstream. So the disparity between 5.2 and 6.5 is massive. And there's many people that have heart attacks and strokes in that A1C group. But if their A1C is 5.2, but their insulin is 24, which is very, very high. Normal insulin is about 3 to 4, fasting insulin. The body's working really hard to keep your blood sugar low. And you want to know that, because that's where you want to treat these patients.
And just for the New Zealand and Australian listeners, we work in international units, and so I think our blood sugars, I think our HbA1c is about 41. Is that tip over?
Yeah, the A1C that I'm using is percent. Yep. I've got tables up here because I have a lot of international patients. So we're talking about blood sugars over about 5.8 to 6.
Yeah.
So, which is much lower than most people walk in and they've got a 6 or a 6.2, and the doctor says, oh, you're fine.
Yeah.
No, you're not. No, you're not. A normal blood sugar is around 4.4, 4.5.
Yeah, I think my ranges I use are about 4.9 is the top of the range.
Right, that's the top of the range.
Yeah, and 36 is the top of the range, the functional optimal range for HbA1c. And then you're in that kind of subclinical state between 36 and 41. And, but as you say, in that state, that damage is happening all the time. It's insidious. It's an insidious process.
And so if you're going to talk to your GPs, you've got to look at all of those numbers. And most of them don't even test those numbers.
No, they
your hemoglobin A1C may be normal, but you may be producing a lot of insulin to keep it normal. It's taking strain. And that's a problem. Where there's smoke, there's fire, and that's what they're not looking at. They're looking for flames, they're not looking for smoke.
So I encourage everybody listening to this who may be a diabetic or have obesity and who is dealing with their GP to please share this podcast with them, because, Dr. Rob is an absolute international expert in this. And you must have been one of the first people to make that association between carbohydrates and liver in your PhD that you did. You must have done it very early on.
We did, Susan. The data was there, but because our hypothesis was polar opposite, and we so intensely believed in the hypothesis, for a long period of time, we blew off the data, even though it was slapping us in the face. So I've been as much a victim as all of your doctors, as all of the doctors that are treating patients saying, oh, you're fine, because my belief was so strong that sugar can't cause harm, that I was unable to reconcile the data I was getting, that were the facts, with the fact that my theory was wrong. And it took me a decade before I really did that. But this is from 1990 to 2000. And in the late 90s, early 2000s, that's when we really started to develop the carbohydrate addiction model rather than the lipid heart model, which is, you see, most doctors that buy into the lipid heart believe that the consumption of fat is clogging our blood vessels. Just like if you throw bacon grease down the drain, it clogs the pipes. But the human body doesn't work that way. As I said already, whether you eat the apple or the donut, what enters your bloodstream is glucose and then gets reformed. Well, exactly the same when you're eating fat. The metabolism of that fat is entirely different. It doesn't just automatically clog the vessels. And the paradox is, the more fat you eat and the less sugar you eat, the more pristine your blood vessels are.
So would you just give us a very brief explanation of how, the difference between why the sugar damages the blood vessels and what happens with the fat and the cholesterol?
Right. So if we take somebody who's had a stroke and a heart attack and you do an autopsy on them, you'll find that their blood vessels are clogged with fat and cholesterol. So it's there, it's present. You can see it. I've had it as a surgeon. I've had it in my hands. The question is, why is it there? And did that stuff just gather there and cause the heart attack, or is it responding to some other injury? In other words, is that fat in the blood vessels the arsonist or the fireman? You go to a house that's on fire, you see a whole bunch of firemen. Oh, look, the firemen are burning the house down. No, they're not. They're trying to put it out. And if you understand clotting biology, continuously our blood vessels are being injured. They form a little clot, a tiny little clot that seals the hole. And then we bring in some cells, and the cells attract some lipids, some fat deposition. And it's like, if I punch a hole in the wall, that's the injury. If you then come along and you put some spackle on that hole to seal it up, that's the body's response. And the final layer that the body uses to seal that injury is the deposition of fat and cholesterol. And that's being remodeled all the time, and it doesn't cause damage. That's an ongoing deposition removal thing. But if you have chronic, massive injury, you're forming more clots than you're able to remove them. And therefore, those clots are forming, you're getting all this lipid coming along, and now you're getting layer after layer after layer after layer of lipid because the injury is perpetual. So what causes the injury? And this is what I did in my PhD. What causes the injury? There's two primary molecules that cause the injury. Number one, nicotine. And number two, sugar. Now, elevated levels of sugar, they damage the endothelial cells. And when those cells get damaged, they cause some clotting to seal the damage. And if you've got repetitive damage because your blood sugar is high all the time, and perhaps you're smoking or you're smoking all the time, now you're getting the layering. Does that make sense? So the fat is only there because of the injury. If you do not have the injury, the fat isn't there. And you've got pristine blood vessels. So what's interesting in the 1950s, as well as now, 1950s, when you looked at people who died of heart attacks and strokes, you saw all that fat. So we made the assumption that fat was the problem because obviously cigarettes cause no harm. But when we blamed fat in the diet, the people that didn't smoke and the people that did smoke had the same amount of fat in their diet. One had pristine blood vessels, the other one had vessels clogged with fat. And there was a guy called Ansel Keys that promoted the theory because he beat up fat without ever considering cigarettes, because the tobacco companies told him, come on, we're good people, tobacco's fine.
Trust us.
Right, now in the modern era, I've got plenty of patients who eat huge amounts of fat, who are pure carnivores. They'll eat a ton of fat, bacon grease and all that stuff, and their blood vessels are pristine. Their cholesterol's through the roof. The LDL cholesterol's through the roof, but their blood vessels are pristine because fat doesn't damage the vessels. Fat is the fireman, not the arsonist. The arsonist is sugar.
Excellent explanation. And would you just briefly, you spoke a little bit earlier about the difference between, the sugar, the damage that the sugar does, so we ingest it, and then the gut damage, and then the damage that the insulin does. Would you talk just a little bit more about, the cancer and the Alzheimer's, because they are becoming, very serious diseases.
Right, and there are multiple diseases. And so one of the things that we've got to understand is in healthy human beings who are not modern human beings, and our ancestors, and whether it's the Maori ancestors, the Bushman ancestors, people who lived off the land, they typically ran at very low blood sugar levels. So the molecule, the enzyme, or the hormone that is responsible in healthy human beings to maintain blood sugar is not insulin, it's glucagon. Because most people have a low blood sugar, and glucagon's job, as I said earlier, is to drive the liver to turn protein and something called fat called glycerol to produce sugar and to release sugar from the liver. So glucagon is continuously supplying sugar to elevate that level. Insulin only becomes a sugar controller at super high levels. But insulin was discovered in type 1 diabetics in Canada, Banting and Best, and they already had high blood sugar. So we made the assumption that insulin is the hormone that controls sugar. It is not. It is not. Insulin only controls high levels of sugar. It really doesn't have a huge amount to do with sugar clearance when you're living healthy. However, insulin is the most important growth hormone, anabolic growth hormone in the body. Just like human growth hormone, everyone's injecting growth hormone to have big muscles so they can try to beat South Africa. No, growth hormone, testosterone, and insulin and thyroid hormone are your anabolic hormones that create tissue repair, tissue growth, add muscle. That's their job. Glucagon, cortisol, some of the other hormones are catabolic hormones that break tissue down, that clear damaged tissue. And you want the body to cycle through those. Insulin has very enormous properties from a genetic perspective. It controls in the nucleus of the cell, it controls some of the genes. So, but it should be up and down. If insulin is continuously elevated, now insulin controls cholesterol production. So you should be producing cholesterol during meals under insulin. And then for the rest, it should be ketones along the same pathway. When insulin levels are low, you're producing ketones, which are the dominant building block for cells. So insulin controls a number of different functions in the human body, not related to sugar. And it should be up for a few hours a day, maybe twice a day, and then low. However, when you're eating a lot of sugar, your insulin levels are up all the time. So you're producing massive amounts of cholesterol. In the cell, you're turning genes on and never switching them off. So for example, breast cancer, the HER2/neu gene, the BRCA gene, the Angelina Jolie gene, she had a double mastectomy because she has a family history of that genetics. That gene is activated by high levels of insulin. If you have normal insulin cycling, your risk of breast cancer is no different than everybody else. But it's that high sugar, high insulin diet that activates that. That's why breast cancer over the last 30 years has become the commonest form of cancer in women. When I was training in medical school, it was rare. So same thing with prostate cancer in men. So those diseases have become prominent because of that hyperinsulinemia where there's no fluctuation. And the breast cancer genes are genes that should stop. When they're on, they stop cell division. Well, if insulin doesn't switch them on, then the cells keep dividing, and that's called cancer. In the brain, most of the brain is fat. And I've just done on my YouTube channel called Carb Addiction Doc, I'm actually halfway through a series of interviews with one of the world's experts in Alzheimer's ketones. In the brain, the majority of the substrate of the molecules in the brain is fat. 65% of the brain is fat. 20% of the entire body's cholesterol is in the brain, even though the brain is only a small percentage of your body weight. So we need fat, we need cholesterol. Well, the three little pigs story. If you build your house of straw, you build your house of sticks, the house is not very strong. If you build your house of bricks or stones, it's a very strong house. Same thing with the brain. Brain cells are being damaged and injured all the time. And while you can't develop new brain cells, you're repairing those cells all the time. Well, the molecule you want to repair the brain cells are ketones and fat. But if your insulin levels are high all the time, it's shoving sugar into the brain. Even though sugar enters the brain without insulin, your blood sugars are high all the time, your ketone levels are flat. So you don't have bricks and mortar for the brain cells. You've got sticks and twigs and straw. And then the brain cell doesn't heal itself properly, so it dies. And when we get into our 40s and 50s, I'm going to give you a very interesting story. We get into our 40s and 50s and 60s, now we're starting to see that dementia and the cognitive impairment. But here's an incredible statistic. It just dropped on my video channel yesterday. This guy, Stephen Cunane, a PhD from Canada, did a study where he was looking at insulin resistance, hyperinsulinemia. And he studied people with hyperinsulinemia. Well, polycystic ovarian syndrome, for those women out there that have that, that's where you have a lot of hair, your periods are abnormal or very heavy, you look almost masculine in your fat distribution, big bellies instead of the fluffy fat that women should get under estrogen. It's an androgenic effect, but that's high levels of insulin. Polycystic, so he looked at women with polycystic ovarian syndrome and hyperinsulinemia, and he measured their cognitive function. And it's a test that you can measure it with how well your brain works. And he found significant evidence of cognitive impairment in the cohort of women with polycystic ovarian syndrome. Take a guess how old, what the average age of those women was, who have demonstrable pre-dementia, pre-Alzheimer's, cognitive failure because of their high insulin associated PCOS. How old do you think that cohort of women was?
Well, I'd guess they're probably in their 30s.
23.
23, goodness.
23. So he was able to measure cognitive dysfunction in high carbohydrate consumers, hyperinsulinemic people at the age of 23, and it probably started in their teenagers.
Yeah, or maybe even younger, I suppose.
So, yeah, so you can imagine if you're going to university and your brain doesn't work so well, how much you struggle. And so it has huge economic impact because now you're not able to get through university, you're not able to do certain tasks or certain jobs. As a young 20-year-old, that's where you're getting into the workplace. So you're down on the socioeconomic ladder. It affects so many people. Now, the beauty is that Stephen was also able to show reversal of that cognitive impairment by getting the patients on a ketogenic diet, lowering their blood sugar, lowering their insulin. And he did that by adding ketones, by adding MCT oil to their diet, and also some marine fat, the DHA and the fish oils. He was able to repair that damage. So it's still repairable when you're young, but when you're 60 and 70 and now you've got a bunch of dead cells in your brain, that's irreparable, and that's Alzheimer's. So, and that's directly related to hyperinsulinemia. So it factors in, you've got your cancers, I've mentioned PCOS, which you didn't even mention, and it's so common in women. It's the commonest cause of infertility in women is PCOS. So they're going through all this infertility treatment. So they stop eating sugar, they get pregnant. In fact, what's funny, Susan, is the commonest complication I have in my practice in my young women, 12% of my young women who go on a ketogenic diet end up getting pregnant in the first year after because they've all got polycystic ovarian. Oh, I'm not going to get pregnant. I don't have periods. And I have the contraception discussion with them. They blow me off. Then I have to have the bump discussion with them. It's kind of an interesting side effect. So if you go on a ketogenic diet, protect yourself.
Oh, excellent.
In fact, a friend of mine, Ken Berry, that happened to him. Ken is my age. Right. And the day before he was due to have his vasectomy, his wife came up and said, Ken, guess what? And she's just had a baby a couple of weeks ago. If you don't know who Ken Berry is, I would urge everybody to Google him. He's got some wonderful practical advice on how to live in the space.
He does, and I've interviewed him on the channel, so people can go and check that out as well. And I'd love for them to go and check out your channel. So people can find you anywhere as the Carb Addiction Doctor.
Yes, Carb Addiction Doc. I'm on YouTube. I'm on Facebook. I'm on Instagram. My wife is Carb Addiction Mom on Instagram, so it shows what we eat in our family. I've got a little baby. He's on there. He's a little carnivore. But Susan, can I just briefly talk about something that you sideways mentioned, but I think this is so important. You're saying in your keto club, you're working with a number of people who are on a limited or fixed budget.
Yeah.
And one of the darts that gets thrown against the ketogenic diet people very commonly is, I can't afford it. And there are too many people in our space that say, oh, you have to eat grass-fed, grass-finished beef, and you have to eat organic this. And you know what? Yes, if you can afford it, the healthiest quality meat is the best meat. But I don't care if it's an old cow that died of a seizure. It's still better than eating a bowl of cereal. And in the era now where we're heading toward a recession, it is going to be cheaper to buy meat of any quality than it is to buy those other products. So don't ever use financial difficulty as a reason not to eat real food. Fast food in this country, in the US, is more expensive on a daily basis. A Big Mac, fries, and I assume you're at McDonald's there's a McDonald's that's just opened up on the moon right now, just in case someone comes by. So, a Big Mac, fries, and a Coke, a large Coke, costs more for one meal than I spend on food in a day.
Yeah, and
so it is absolutely not true.
I've seen that, and they come with the sugar-free, the sugar-free Coke, which is about $5 for a for a drink. And I mean, you can buy an awful lot of mints and some some eggs for $5.
Right. So the eggs are going to be a lot cheaper. The other thing also is that a can of oysters, a can of sardines, a can of tuna. Those are some of the healthiest foods you can eat. They're dirt cheap here. And are they perfect? No, but they're perfect for us. So, even if you shop and you buy the lowest quality meat, something that was raised in a feeding lot and raised, eggs, when you look at an egg, it doesn't matter if that egg was a broiler in a cage or a free-range organic. If you hatch that egg, it's still going to form a perfectly good chicken. So the nutritional value is marginally different. But I tend to buy the cheapest food I can get, and I'm still a lot healthier now than I ever was eating grain and carbohydrate-based products. So don't use your economic status as a reason not to do this. It's about not eating sugar and starch. It isn't as much about what you eat. And then the other thing is this: if you prefer to eat vegetables, they're perfectly fine. In my program, vegetables are free, just no grains, no rice, no potatoes. But if you want to eat some beans, if you want to eat some carrots, if you want to eat, nobody ever rushed home after a bad day and pigged out on Brussels sprouts. We're not obese because we ate vegetables. We're not obese because we ate animals. We're obese because we primarily ate processed, high-level carbohydrates.
That raises a couple of other questions. I was chatting to one of the people from the Keto Club on Monday night, and he was saying that his doctor has told him that, I'm encouraging him to eat more fat and protein, and we're looking at ways we can reduce, because he eats a lot of chippies and all those carbohydrates. And we were looking at ways of reducing those. And he says, well, I can't eat meat because of my gout. And my doctor told me to stop eating red meat. So, your thoughts, please.
I've actually done on my YouTube channel is a couple of episodes of gout. The commonest cause of gout in the modern era is a sugar called fructose. And the way the human body, if you eat excessive amounts of fructose, which is found in Coke, it's found in fruit, it's found in most processed food, it's the sugar that combines with glucose. Fructose is very poorly metabolized by the human body. And as a spin-off, you produce uric acid, which creates gout. So as my patients come off fructose, for a first month or two, they may see a flare of gout as their body resets. And you treat that with allopurinol or colchicine. But within a month or two, your uric acid level, and this is what we measure in our office, your uric acid levels come down, they normalize, and red meat does not cause gout. I can assure you of that. Red meat plus fructose causes gout. But don't blame the red meat, blame the fructose. So absolutely not true. And the reality is, if you really are afraid of red meat, it doesn't preclude you from eating chicken, from eating fish, from eating non-red meat foods, pork. There are plenty of things. Some people don't like red meat. And you don't have to eat a lot of animal food. I've got plenty of patients who are primarily vegetarian, who maybe eat fish once or twice a week, who eat some eggs, or who may do some dairy. There's plenty of nutrients in that small amount of food, and you can be vegetarian if you choose to be. It's not a crime to eat vegetables. For some people, it doesn't disagree with them. I eat vegetables. I'm mostly carnivore, not because it's healthy or better, just because I prefer to eat that way. But if I go to a restaurant and they've got some salad or an asparagus, I'll eat it. If they've got a baked potato, there's no way on God's earth I'm going to eat it. Mm-hmm. So those are all the choices that we make. But it's not that difficult to eat this way. The other key thing I didn't talk about, everyone talks about the food choices. But when we're under the influence of sugar, we eat multiple times a day. So you're snacking, so one meal, one bowl of cereal might not cost very much. But if you're eating 8, 10, 12 times a day, that's cumulative. And all those candies and all, I eat once a day. And it's now almost 7 o'clock at night here in the US. I was up at 4:30 this morning. I've had a few cups of coffee. I haven't eaten yet. Haven't died of anorexia, and I'm not hungry. Because I'm in ketosis, because I'm burning fat, my blood sugar is not doing this. My blood sugar is rock steady. I can tell you my blood sugar right now is in the low 70s. And I'm on no medication. I'm almost 60 years old. The only medication I take is a fish oil because I've got a strong family history of Alzheimer's. But other than that, I'm on no medication. So, when you go to, this is something I spoke to somebody about today. If anybody criticizes a ketogenic diet and they're in their 40s or 50s or 60s, when I see patients in my office, I don't ask them, are you on medication? I ask them what medications you're taking, because almost everybody 50 years and older is on some medication. So if they criticize my diet, I just ask them, okay, what medications are you on? Well, I'm on this for blood pressure and I'm on this for my diabetes. And he wants one. You know what medications I'm on? None.
That raises another really interesting point. I had an email from a lady a couple of weeks ago, and she listed all the medications for all the different symptoms she had. And then she said to me, I'm as healthy as a horse because these drugs are keeping me healthy.
Exactly right. And, if you've got acid reflux, a very common problem, you get rid of carbohydrates, within a week, your acid reflux goes away. How many people aren't on medication or swigging antacids or chewing Tums, if you have them in New Zealand, to suppress stomach acid? Get rid of the carbohydrates, your reflux is gone. So you can't just look at the cost of a steak. You've got to look at the global cost to your health. The medications cost, well, in New Zealand, they may be free, but they're going to cost you through your taxes, through indirect costs, the cost of multiple meals a day, the cost of productivity, the cost of mental well-being. There are so many issues related to this. The poorest alcoholic is still going to find a way to buy booze. And it's the same principle here. You can afford to be healthy. It's always your choice. Even if you go to a food bank, and there's lots of people in this country that depend on food banks or have people that provide food to them, you don't always have to eat the dessert. You don't have to eat the bread. You can eat what goes on the bread. There's always ways to eat appropriate food. And it's not about what you are eating, it's about what you're choosing not to eat that's more important.
So Dr. Rob, do you have a couple more minutes? Because I would just really love to hear about some of the solutions you have for people. So when people are saying, look, I just crave it, I can't stop eating it. I've heard you speak, and it's something that I talk about quite a bit, is trying to use bridging foods and things like that, because we do have to eat, and we can go no to alcohol, but we do have to have food. So I'd love to hear some of your insights about what people can do to start to separate themselves from
So let me just correct something. Whenever you talk, I just saw a little red flag. Yes, you can say no to alcohol, but you can't say no to water, you'll die.
Yeah.
You can say no to carbohydrates, but you can't say no to food. You never have to say no to food. You see, nobody tells an alcoholic what they should drink. The only thing an alcoholic should do is stop drinking alcohol. What they do drink doesn't matter as long as it's not alcohol. Exactly the same here for an obese person, a diabetic person. I don't care what you eat. I don't care what you eat. What I care about is that you don't eat crystal meth, that you don't eat sugar and starch. So we've confounded this by making this a diet problem and a food problem. It isn't. It's a drug problem. And the drug is sugar and starch, not food. I don't care what you eat, as long as it's not sugar and starch. And that's a very important point.
Right.
So, but we spend too much time telling fat people what they should eat.
Mm.
And that's crazy. The default is if you're not eating sugar and starch, you can't be fat.
And so we need to, make it clear for the listeners, we're talking about all the processed food out there. Are you talking about fruit in this case?
If you're already obese, yes.
Yep. And then you're talking about starch.
Right, your body can't handle that sugar anymore.
Yeah.
So, however, one of the, you asked me about how do you approach this? Because yes, the obese person, as I said, I've been there, my brain is still fat. This may not be, but this always is and always will be. So I'm having that little discussion, that little debate, that little fight all the time. The worst day for a smoker is the day after they quit. It's miserable, but it gets better every day you stay quit. So when it comes to the diet approach to, here's your diet, you start tomorrow. That's miserable. If you can't swim, don't jump into the deep end of the pool. Learn to swim first. So when it comes to our approach, the first step is ownership. Yes, I am a carbohydrate addict, not a food addict, because that's impossible, but a carbohydrate addict. And the ownership comes from looking at your environment. How often am I eating these things and why am I eating them? I've just had dinner. Why am I sitting in front of the TV with a bag of chips? I'm on my way home to dinner. Why am I in the line at McDonald's? I walked past someone's desk because I was talking to them. I saw some candy and I ate it. So you got to look at who you are and have that ownership. Once you have the ownership, you've then got to decide, yeah, I am fat and diabetic, but I don't care. I love this stuff. You can't help that person. You can't help the alcoholic who doesn't want to help themselves because you cannot outsource this. But if you say, look, I love carbohydrates. Yeah, I know you do, but I hate being fat more. Now let's work with you. And the way you do this is to take little baby steps. The way you eat an elephant is in little bites. If you try to eat the whole elephant, you're going to choke on it. So spend a week changing what you drink. Don't change anything else. Get rid of the orange juice and the Coke. Have Diet Coke. Have right here. There it is. There's a 0 sugar root beer. Most people say that's terrible. You know what? I probably won't drink this today, but I see it. It's there. And if I know it's there, my desire is not for orange juice or a Coke. Do I want this or not? Now, this guy's been here for several years.
Yeah.
But he's there and I can have him at any time and it's not a crime to have him. So bring in a whole bunch of things that you can drink. Mostly I'm drinking coffee and water, but there are times when I'll drink that diet root beer or a Fresco. I'm not looking for perfection. I'm looking for sugar-free. Mm. So the first thing you do is create a relationship with something that you can drink that makes you feel good, that doesn't contain carbohydrates. That's all. I don't care what you eat. You can eat a bag of M&Ms every day, but the first week, change what you drink. Once you are comfortable and have developed a bit of a relationship with something that you can drink, for me, it's coffee. It's got a little bit of heavy cream in it, but no sugar. If you want to put an artificial sweetener in there, don't criminalize the artificial sweetener. Because if an artificial Splenda allows me to drink the coffee, I'm okay with that. Because the other option is to go back to stay with the Coke and to use the fact that you don't like bitter coffee to add 4 spoons of sugar. No. We're looking for good enough. So we've got to do this from a human behavior perspective, not a perfectionistic perspective. Then the next step is this. Plan 3 or 4 meals a day. But plan those meals ahead of time. I don't care what you eat. And then slowly look at that plate of food and start with the meat or start with the vegetables, eat the meat and vegetables. And if you can reduce progressively the amount of sugar and starch, the amount of potatoes, maybe eat what goes on the bread, not in the bread, eat the tortilla, not the shell, because those carbohydrates are just vehicles to put them in your face. Do the British thing, eat with a knife and fork, not with your hands or just scooping it in. And slowly you can eliminate in your food the carbohydrate vehicles, the rice, the potatoes. If you pile the plate up big enough, you don't need the rice or the potatoes or other things. You can learn to live without them. Plan 3 or 4 meals a day. And what you're going to find over time is, okay, I know it's a mealtime, it's breakfast or it's lunch, but I'm not hungry. Then skip the meal. Skip the meal. And you know what? The next meal is going to be pretty soon. You're not going to die of anorexia between now and that next meal. And in that way, you automatically engage in what Jason Fung calls intermittent fasting.
Mm.
But intermittent fasting should happen. It shouldn't be forced. If your blood sugar is doing this, you're going to be miserable. If your blood sugar is kind of doing this, it's easier to fast. So allow fasting to happen, but eventually you want to end up with 2 meals a day planned ahead of time, because you're going to make nutritional choices ahead of time. I knew last night that I was eating steak tonight. But if I'm all miserable going home and I don't know what to eat, I'm in the line at McDonald's. So plan ahead, and you're going to make nutritional decisions. In the moment, you're going to make emotional decisions. And so you get to a point where you're eating 2 meals a day. I don't care how much you eat, meat, vegetables, but get rid of the carbohydrates. You can still snack. Stage 3 is where you start getting rid of the snacks. And you can do that in 2 ways. You can go from M&Ms and pretzels to pork rinds, pepperoni, and cheese, and then slowly let those go. Or you can go cold turkey and just go to your coffee or your water or your Diet Coke or whatever it is. And then the 4th one is where you really get rid of the lookalikes. I don't care what words they slap in front of it. Rice is rice, whether it's made of cauliflower or real rice. The intent of eating it is still up here, not down here. Right. So if you're going to eat cauliflower. Don't make cauliflower rice. Don't eat keto ice cream. Don't make keto brownies. All the lookalikes are really just there to sell you something. So you want to eat real food, and you don't want to eat something that triggers your head. But that process may take a month, 2 months, 3 months. It's being the tortoise, not the rabbit. Because the rabbit falls asleep and slides backwards. The tortoise, for the rest of their lives, makes little more forward movements. So in addiction management is all of that. And then the other important part, as I said, be empowered by what you are going to eat. Don't feel deprived by what you're not allowed to eat. That's the first thing. The second thing is, every day, do something for emotional emancipation. And it's about going for a walk. It's about playing a game of cards instead of having dessert. It's about building a puzzle. It's about reading a book. It's about listening to music. It's about doing something creative to make you feel good. It's about reconnecting maybe spiritually or having some meditative time. It's about having empathetic human relationships to offset against emotional tension. Developing an effort-based emotion management system as a replacement for an instant gratification system is the holy grail of addiction management. And if you are now using things that you do instead of consume for emotion relief, and you develop that on a daily basis so that it's there for you on bad days, you're far less likely to relapse back. Because doing a ketogenic diet is easy for a little while, but sustainability is the greatest problem. 98% of diets fail. But the addiction principles, you may relapse, but you do it again and again and again, you get better and better and better at it. So built into our program is, okay, you screwed up. Pick yourself up, learn from your mistakes, correct them, and let's move forward. But that's the way you change, is by improving on your mistakes, not abandoning things because you screwed up. So it's a progressive transformation. Nobody quits smoking the first time. You're not going to quit eating carbohydrates the first time, but there's always a last time. And that's the one you're looking for.
Absolutely wonderful, wonderful advice. Another question around that, what about when family members, and the community that you're living in is not supportive of you needing to make these changes? And
very, very difficult. Very difficult. And depending on who you are, I can tell you this. I've been doing this personally for 23 years. I lost my weight 23 years ago. If there is a tub of ice cream in my house tonight, I can guarantee you I'm going to eat it. But I can also guarantee you it's not there. Because your best protection against yourself, and you're really protecting yourself against yourself, is distance. But if it's right there, proximity, especially under emotional duress, is a very challenging thing. So part of it is engaging in conversation with those people, but part of it is looking at your own personal environment and finding out how to protect you from yourself. I'll give you an example. At the hospital, we have free food. So I don't eat the food, but because it's all carbohydrates. I mean, it's ridiculous how quickly they make doctors diabetic in the hospital, but they've got a coffee machine at the back of all of that. So if I'm feeling okay, I'll go get myself a cup of coffee. If I'm feeling a little emotionally vulnerable, there's no way on God's earth I'm going to go into that room, because on the way to the coffee, the donuts is right there. So I've got to know me and know where my vulnerabilities are and try to avoid those situations. Same thing in the home environment. You may have to make different food for yourself, but you never, ever are responsible for buying food for somebody else. In other words, I get patients say, oh, well, I had to buy the bread because my husband loves his bread.
Yeah.
Well, do you go out and buy your husband his heroin? You didn't buy that bread for your husband. You attached his name to something you were buying for yourself. If your husband is old enough, he can go out and buy his own bread, and he will not die of anorexia if he doesn't have that bread. So if he's miserable and bitchy, that's his problem. But don't make his problem your problem. It is challenging. It's much better if we get together as a collective and do the right thing. But at the same time, we have to manage ourselves. And the best way to manage that exposure is through the word arrogance. You know, a vegan is never, ever apologetic about the fact they don't eat meat. They don't feel deprived of meat. If they come into a place and you offer a vegan a steak, they don't say, oh, no, I'm sorry, I don't. You bastard, how the hell can you kill Bambi? They're arrogant about the fact that, and that arrogance protects them from eating something as desirable as meat. So if you can become arrogant about the fact that you don't do those things, there's your protection. If you feel deprived, whether it's in your house or not, whether somebody else, you're going to find it.
And I think that's a good point. You know, I often say to people, we never say, oh, I'm sorry, if they offer you a cigarette, we never say, oh, I'm sorry, I can't have that. I'm not smoking at the moment. You just go, oh, no, thanks, I don't smoke. And nobody thinks twice about it.
Right.
And so you should be able to just say, no, I'm sorry, I don't eat that.
And I think the other little weapon that I teach my patients, if you're at a party or so, oh, come on, just have a pinch, it won't hurt you, because the diet mentality is a little bit is okay, a lot is not.
Yeah.
However, in addiction management, it's crossing the threshold of permission. It doesn't, one sip of beer won't make anybody drunk, but if you're an alcoholic, you don't cross that threshold of permission. But the answer because most people don't care if you're on a diet. They don't care if you're trying to lose weight, but they do care about diabetes. So if you say, hey, I can't eat that because of my diabetes or because of my insulin resistance, and you cannot be fat without being insulin resistant. You cannot have diabetes without diabetes, just the nth degree of insulin resistance. So you're not lying to them, but they will listen to that. They may not listen to, I'm trying to lose weight, but they will listen to, hey, that makes my diabetes worse. And so you can have that discussion. And most people will respect the disease of diabetes if you're comfortable enough, if you are vulnerable enough that you can share that with them. And it's the truth. It is absolutely the truth.
Well, this has been amazing discussion. My last question for you would be around our children. This is what absolutely breaks my heart. And I think we had our first type 2 diabetic child in New Zealand diagnosed in the 1990s. And, now it's an explosion. What would you say to parents? How do you encourage parents to not set their children up for this path in the future?
Well, I think the first, and it's not always, you can't always do this, but it begins before you become pregnant. In other words, the healthiest families are ones that decide up front that we're going to have a baby, and they then try to get pregnant. Well, as part of trying to get pregnant, you've got to come off your birth control. You've got to know when you're ovulating. But as part of that, both the man and the woman, more important for the mother, is to say, hey, I'm going to get rid of the carbohydrates before the baby's born, before the baby's created. I'm going to eat right, because most women, if they're planning a pregnancy, are going to take a prenatal vitamin. But don't take your prenatal vitamin with a tub of ice cream. The prenatal vitamin is important, but so is not eating sugar and starch, because you're creating a more fertile, more receptive environment for that baby to implant. Your likelihood of pregnancy is higher because that baby is affected biologically as soon as the sperm and the egg meet. So, my son has been a carnivore since before he was a zygote, before he was 2 cells big. And then it is incumbent upon that mom to reduce her consumption of carbohydrates. The commonest problem we see in pregnancy, with a 7-fold increase of loss of pregnancy, is gestational diabetes. In fact, most gynecologists will tell you, and most pregnant women will tell you, they've been tested multiple times for diabetes. And then they're getting hypertension, they're getting preeclampsia, they're having premature birth. the negative impact on that baby, not because of the baby, but because of the mother, is enormous. And it's so easily corrected if she doesn't eat carbohydrates. So the more animal products, the more animal and vegetable products she eats without carbohydrates, the healthier that fetus is going to be. The second thing when it comes to addiction is babies are imprinted. So after about 6 to 8 weeks, the baby's brain is formed by about 6 weeks, or begins to form at about 6 weeks. So imprinting is where, when the mom's stressed, her heart rate's up, there's a certain hormonal milieu. If she goes for a walk to de-stress, that baby is going to associate physical activity with emotional management. If the mom eats some M&Ms to de-stress, the baby's going to associate a spike in blood sugar as a way to relax. So afterwards, as soon as that baby's exposed to sugar, it's going to have that imprinted knowledge. It's going to be triggered. So imprinting is as important as what you do afterwards. So we manage a lot of patients of pregnant moms before they're pregnant. Now, unfortunately, most of the moms that we manage are ones that have had bad experiences before. You know, the first time mom, I'm Superman, I can eat. And in pregnancy, we give pregnant moms permission to eat all kinds of crap.
Yeah.
But that damages the baby. Now, once the baby's born, breast milk is the best milk. But for example, my wife was unable, for physical reasons, not to breastfeed. So most formula in this country is basically baby milkshakes. You might as well just add some heroin to it to make it complete. It is awful stuff. So we actually got our milk from our formula after about 6 weeks of failing to breastfeed from Europe, which was a much, much better formula. And we gave that baby from the beginning some DHA fish oil for the brain development. So DHA, EPA, very important in the formula that you're eating. And for a long period of time, we didn't have that. And that's why we had so much brain maldevelopment in our youth. So the formula is important. And then if your baby is otherwise healthy, start them eating real food at 4 months of age. Now, because it's much easier to prevent carbohydrate abundance than to correct that after the baby's already addicted to it. So, for example, my son, the very first thing that he ate at 4 months of age, before he had any teeth, was a strip of ribeye steak. And he gummed that thing, he sucked it to death. I held it, it was a big chunk. He didn't choke on it. And since that time, that's what, so, you know, if you go back to first world people, and I know New Zealand's got the Maoris, the Aborigines in Australia, the Bushmen where I am, how did they process that type of food? The parents chewed it. Every mammal, almost always, chews food. So when my baby was eating meat, I chewed the meat. It gave him my saliva, it gave him my bacteria, and he ate it. Oh, that's disgusting. How can you do that? Well, what do? Do you buy your baby's Gerber slop to give them crap for food? You know, all because I chew up my food, you're having some dirty machine do it on your behalf, doesn't make it better. Doesn't make sense. So you know, the Gerbers are my punitive, but I pre-chewed that. But by 10 months, my baby had all his teeth, not because he's special, or because when you feed a baby food that has to be chewed, their jaw development is perfect. Nobody should have crooked teeth. But we get crooked teeth when we're drinking slop for food and we don't develop our jaw and our muscles for our jaw. My baby will deprive some poor orthodontist of braces because he's not going to need them. His teeth are perfect. And it's because he's been chewing since 4 months of age. And they won't choke. You've got to watch them, but they do really well. And if you cut that food up and you chew it fine, they're fine. And if what they're eating is meat, I can offer my baby a potato right now, and he doesn't know what to do with it because he's never had one. So you want to start very early on. And if the babies are eating some vegetables, but mostly animal products, and dairy is a very important part of a baby's diet because they need some sugar. There's sugar in breast milk, but it's mitigated by the amount of fat. Oh, but your baby's carnivore. What about pooping? Well, you know what's interesting? And this is where human beings think they're better than God and nature. One of the massive distinctions between all formulas and breast milk. When you look at a formula-fed baby, they're making these massive poops. Breastfed baby sometimes will have a massive poop, but usually it's a small poop. Why? Because most of that breast milk is absorbed. Most of the stuff coming out of the baby is stuff they didn't absorb. So it's garbage in the food. And what we humans have done is we've put fiber in formula. Breast milk has no fiber. So if fiber was necessary for a healthy poop, all babies should explode. but they don't. Fiber is unnecessary for normal human bowel movements. And yet, because we diminished the amount of fat in our diet, now we've added fiber to everything. Oh, God and nature, you guys are wrong. You left fiber out of breast milk. We're humans. We're better than you. We're going to put fiber in our breast milk. Ridiculous, crazy, nuts.
And we see that whole fiber story going back to the cholesterol. And I've seen so many of my clients who, once we've reduced the fiber out of their diet, their constipation has actually improved dramatically.
Fat, water, and salt. Three best ways to have a healthy poop. So we don't need fiber, and we're not going to explode. So we can talk about that some other time. But so you're talking about baby. So if you raise your baby from an early age with dairy predominance, but mostly on meat and some vegetables, they don't desire the carbohydrates. They'll be as healthy as you can possibly be. Their brain growth, their physical growth, their musculature. I mean, my baby is definitely going to be a front row guy. He's huge, but he's pure muscle.
Look out, All Blacks.
Oh, look out, All Blacks, because he is going to be the front row, and he's not fat. You can go to YouTube, you can go to Instagram, Carb Addiction Mom. You'll see pictures of my baby, but you'll also see pictures of what he's eating. And you'll see how healthy he is, brain and body, and how happy he is as a child, because he's not getting high on drugs, he's getting high on life. So if you start early, and that becomes the paradigm. Now, when a kid goes to a birthday party, they may interact with some carbohydrates, but take it or leave it. And most of the time, they're not going to eat them. Does that make sense? And it's, but you're depriving them. I'm not giving my baby a treat when I give him some chocolate or some chips. I'm saying, here, baby, here's a little obesity for you. Here's a little diabetes for you. Here's a little depression for you. Here's a little bit of illness for you. That's not a treat. I don't feed my baby diabetes.
And a treat, and really a treat with your child is reading a book to them or singing with them or... Absolutely.
The best treat is human connection. The best treat is a hug from dad's presence. But if dad's busy watching TV and he gives the baby a bag of chips, and we use carbohydrates to babysit our children.
And
you look at a baby, a 2-year-old with a bag of candy or a can of Coke, they're happy because they're high. And that is what is ludicrous about how we become as parents.
And, I remember being at a rugby game, All Blacks game, can't remember who they were playing. I'm sure they won though. And
must have been Australia.
Must have been, wouldn't have been South Africa. And, I was watching this, these parents, and they had a toddler who had a whole bottle of Fanta, and they had a baby, and they poured the Fanta. The baby must have been 3 or 4 months old, and they poured the Fanta in the baby's bottle and fed it to them. And,
it's a drug. It's a drug to manage that baby in a crowd. It is, that's a radical example. But okay, I'm not feeding my baby Fanta. That's terrible. But I'm giving them a Capri Sun or some Kool-Aid. Same thing. Or orange juice. There's more sugar in orange juice than there is in a glass of Fanta. But it's natural. No, it's not. Sugar is sugar. And so our distorted reality allows them to do that. Babies need milk. All species, all mammalian species use milk for a prolonged period of time. My son drinks a bottle of milk twice a day to trigger insulin. And for the rest, he's eating carnivore. And he's about as healthy as a human being can be. So, you asked me about childhood. That's the way to do it. Do it from the get-go. To reverse it is incredibly difficult.
What about you were talking about dairy. Gosh, I do need to let you go. I want to be not being very respectful of your time. What about dairy for people who can't tolerate dairy? What are your thoughts generally about dairy?
You don't have to use dairy. In fact, on my patients who are trying to lose weight and they're stranded, I often cut dairy out. But the reason why most people can't tolerate dairy or have an allergy to dairy is not because of milk. It's not because of lactose. It's because of the protein in milk. So that's a true allergy. A lot of people say, oh, I'm lactose intolerant. The reality is that very, very few people actually don't produce the enzyme that breaks lactose down. But if you don't eat dairy on a regular basis, that enzyme goes away. Your body doesn't need it. And so if you're going to start on dairy, don't go and drink a gallon of milk right away because you're going to feel awful. But if you start with a little bit of butter, a little bit of cheese, and slowly recruit that enzyme, you're unlikely to be lactose intolerant. So true dairy intolerance is quite rare. Lactose intolerance is very common because the enzyme is missing. And the bizarre part is most people say, oh, I'm lactose intolerant, I can't drink milk. Well, do you eat butter? Oh, yes, I eat butter. So, there's a reality. So there's an assumption that they can't. Now, if you don't like milk, don't drink it. And you don't have to drink milk, but cheese and dairy is a very useful macronutrient, particularly a good source of calcium. But there are other sources. If you don't like eggs, don't eat them. But an egg is nature's vitamin tablet.
Yeah.
So is liver, but not everybody likes liver. So a small fish, sardines and oysters and mussels, but not everybody likes them. Find something you like. You don't have to eat it all, but find something that gives you micronutrients in your diet.
Oh, this has been amazing. This has been one of the, it really has. It's been an amazing episode. And I really thank you so much for being here. And yeah, I'd love to have another conversation again at some stage. I'm sure there's much more we could talk about, if you're up for that. So thank you so much. Just once again, where can people find you? Where can they find the Low Carb Mum? And and follow you.
Well, first of all, thank you very much for doing this. As you can tell, I'm very passionate about the space, and the more people we can get to understand this, not as a diet or a weight loss or a calorie problem, but a substance abuse problem and the toxicity of the substance, the better. So this is just about spreading the word based on science, but also in a pragmatic way, because everything I've said is supported by science, real science, real facts, not American facts. Be that as it may, I can be found on YouTube. My channel is Carb Addiction Doc. That's the word I use. I'm on TikTok, I'm on Facebook, and I'm on Instagram as Carb Addiction Doc. And then my wife is Carb Addiction Mom on Facebook and on Instagram. And on Instagram, you can see what we eat and drink personally. The other is information. I don't talk about myself too much on my channels. It's more about information, but my wife talks about us quite a bit. So you can track us there. And feel free to leave comments, feel free to ask questions. And then the final piece is I do consultations all over the world. Now, in New Zealand, you've got some fabulous people working in the space. I mean, just brilliant people. So no need to go out offshore to find someone that can help you with the ketogenic diet or ketogenic way of life. There's some superb people there. But if anybody wants to contact me to look at their blood work, to give a second opinion, you can text or WhatsApp 561, I think it's +1 561 517 0642. I call that our bat phone. Leave a message, text us, and we can get back to you. And there is quite a waiting list because I've got a lot of folks waiting to see us. So be patient. We won't see you tomorrow. There is a delay, but you're welcome to give us a shout there. And we have a self-pay rate that my office can help you with. So even if you're in New Zealand, we can interact with you. I deal with a lot of Aussies. The New Zealanders are really well set with great practitioners in New Zealand.
Yeah, that's great. Thank you. And I'll make sure I get all those details into the show notes for people so that if anyone does want to contact you, they can do that.
The final thing I say to people, Susan, is this. Look, there's a lot of controversial things we've talked about, a lot of things that people agree with or don't. I don't care if you agree or disagree with me. My job today is to make you think and think differently about yourself. If I've made you think, whether you agree or disagree with me, I've done my job.
Fabulous. Well, there's lots of other topics we could talk about at some stage. I'd really like to talk about bariatric surgery, and we're having a lot of that being done in New Zealand, and we see success rates for 3 or 4 years, and then things start to go haywire again. So lots of other things.
About 98% of diets fail, and about 85% of bariatric surgeries fail, not because the surgery fails, but because the person doesn't address the root cause, the addiction. They lose the weight. So most bariatric surgeons are excellent at weight loss, but they know nothing about obesity.
All right. Well, maybe a topic for another day. So thank you so very, very much.
You're welcome. Take care, and please give me feedback. I always appreciate how we can do better, good and bad comments. We learn all the time. I am not an expert. I'm a student.